Good afternoon, everybody. My name is Danny Plogger, and I'm the Executive Director of the Virginia Transit Association. I want to welcome everybody to the second 2025 VTA and DRPT Joint Lunch and Learn webinar program. VTA is so thankful for this partnership and the opportunity to offer our members and the Commonwealth's transit community a deeper dive into public transportation's challenges, issues, and processes with insight from the experts. This webinar series would not be possible without the support, partnership, and expertise of our friends and partners at DRPT. Today's program is going over DRPT's Coordinated Human Services Mobility Plan. As a reminder, this program and all former programs will be posted on our YouTube channel if you'd like to go back and review them. As always, if you have any questions during the presentation, please put them in the Q&A or chat box, and I'll ask them at the appropriate time. And a couple pieces of housekeeping. The application period for our third Virginia Transit Leadership Institute program class closes on July 1st. So if you or one of your colleagues is interested in participating in the upcoming VTLI program, please get your application submitted as soon as possible. Second, VTA membership dues for the FY26 year are now due. Thank you to everybody who has renewed your VTA membership so far. You make the work that we do possible. So this afternoon, I have the pleasure of introducing Jess Maffey and Evan Tuten. Jess Maffey serves as Statewide Transit Program Manager for DRPT. She has a master's in nonprofit management from George Mason University and began her career as a program manager at nonprofits in the Richmond area, eventually specializing in grant writing and management for state and federal grants. She joined DRPT in 2023 as a statewide transit program manager, where she manages the FTA Section 5310 Human Services Transportation Program. Evan serves as a statewide transit planner for DRPT. He holds a master's in city and regional planning from the Pratt Institute, where he was awarded an Eisenhower Fellowship from FHWA for research on equitable methods of transit funding. Evan brings several years of experience as a planner for the city of New York, where he also managed aspects of the city's surplus property portfolio and assisted in structuring the financing of transit-oriented affordable housing projects. Evan joined DRPT in the summer of 2024 and is passionate about improving transit access in his home state. So please grab your lunch, sit back, and enjoy a great program from Jess and Evan. Jess, kicking it over to you.
Thanks, Danny. I'll just get my slides set up real quick. Yes. All right. Thank you, everyone, again for joining us. In this webinar, I'm going to be going over the Coordinated Human Services Mobility Plan update. I'll introduce the plan itself, what it is, what it consists of, and then I'll provide a little bit of content for what we've produced so far in our update this year. We already had a great introduction from Danny, so I'm going to move along to today's agenda. As I mentioned, we'll be going over the CHSM plan, as we call it, the overview of what it is, why we do it, how it's constructed, what its elements are. And then I'm going to be presenting just a snippet, basically, of our survey results from the first phase of this plan update. And we'll have some time to pause for questions or comments as you see fit. So to give you an overview of the CHSM plan itself and kind of how it relates to 5310, I think a lot of you are probably familiar with 5310, but I'll go ahead and just describe a little bit about how we administer the funding in Virginia. So we administer the FTA 5310 program funding for Virginia's rural areas, small urbanized areas, and the large urban areas of Richmond, Roanoke, and Hampton Roads. We do not administer it for basically Northern Virginia around DC. That is actually managed by the Metropolitan Washington Council of Governments. and they do their own 5310 program administration up there. So as part of this funding, FTA requires us to produce a coordinated plan, and this plan includes focuses on primarily the eligible population for this funding, which is older adults, people 65 and older, and people with disabilities. So as part of the plan requirements, as we look across the state and start to gather input, we are required to include input from, again, seniors and people with disabilities, the primary populations this funding serves, but also representatives of public, private, and nonprofit transportation providers, our human service providers, and other members of the public. And that reason is because this plan really emphasizes coordination and collaboration among human service agencies and public transit providers. So the FTA is really looking for us to seek opportunities to maximize federal dollars and ensure that these our human service transportation providers, which this funding primarily provides support for, and transit providers are aware of each other and kind of look for opportunities or strategies to enhance collaboration and coordination among those services, as well as among human service providers together who may be serving in an area. In terms of the plan update and the schedule, our last plan came out in 2022, and the plan we're currently working on now will be released in December of 2025. We have typically done a minor update every 3 years and then a major update every 3 years. So this year is what we're considering a major update, where we're looking at basically all the demographic data from across the state, doing a whole fresh outreach effort across the state, incorporating that into new strategies to address gaps in transportation access. So the purpose of the CHSM plan is really to identify the transportation needs of people with disabilities, seniors, veterans, and people with low income, and to provide strategies for meeting those needs. This plan is what helps us, at the end of the day, connect the projects that apply for funding to the plan itself and kind of see where we can connect the projects that come in for funding with the goals we're trying to achieve in terms of what we've identified as gaps in services and opportunities to fulfill those gaps. So as part of that, it helps us prioritize those services and projects for funding and implementation. And that is partially because the 5310 program, unlike some of the transit agencies' funding, is competitive funding. So each year, 5310 agencies that come in, such as nonprofits, area agencies on aging, CSBs, they are not guaranteed funding year over year. And we look at how they're meeting the strategies outlined in this plan, as well as other factors when considering their applications. Just to go a little bit over the plan format. So the plan, when it is produced, comes out as one document covering the entire state, except for Northern Virginia. And it provides a summary of statewide demographics, available transportation, and then those identified needs and gaps in services, as well as strategies to address them. For the plan, since we administer at the state level, we provide statewide demographic information. However, we really look at 6 different regions and kind of focus in on each region and specific strategies to address the needs of those regions. And we'll see that on the next slide here in a minute, the regions we've identified. And so at the end of the day, the plan kind of helps us demonstrate what are statewide challenges, but also those regional challenges, because really a lot of, transportation issues are regional, and opportunities for coordination and collaboration are often at a regional level. For the 2022 update that's currently out and on our website, We also, in addition to the single document, created a story map version through GIS. So if anyone wants to go check that out, it's a little bit more interactive and gives you the ability to see a lot of the data in an interactive map-based format. And there's a lot more information we could include in that format. So we plan to continue the story map going forward to share this information. So again, like I mentioned, the CHSM regions, there's 6 of them. These regions are modeled off of the Department of Medical Assistance Services regions for Medicaid. So this was just a way for us to kind of break up the state and see things at a regional level based on how they've distinguished it. And also wanted to note here that Virginia is not alone in this, but somewhat unique in that we create the CHSM plan at the statewide level. In many other states, this plan often happens at a regional level, as in an MPO or PDC or other agency or body would actually create their own plans at their level, and then the state would combine them into one big statewide plan. So we do it kind of in a more top-down approach. I think partially because just the state is so large and there's many coordinating bodies throughout the state. But it's definitely something we consider every year or every 3 years as we look at the plan as to how it's organized. All right, so getting into the update that we're doing this year. These are sort of the elements that are included in this year's update. So some of these elements are required by the FTA, and some are priority areas that we've identified for this update. So first of all, at a baseline, we're identifying the transportation needs for those eligible populations, so seniors and people with disabilities, as well as incorporating veterans and people with low incomes. We also are understanding the gaps in access to transportation that limit mobility, and then providing feasible, measurable, and impactful strategies to address those gaps. We are also looking at this year a little bit of a deeper dive into funding sources to support implementation of these projects. So we know at the state level that 5310 doesn't fully meet all of the funding doesn't fully meet all of the needs throughout the state. And so we want to continue to look for opportunities at the federal level, at the state level, recommendations at the local level for how our grantees can continue to seek funding to support these projects. And then finally, we're going to be also recommending opportunities to improve the 5310 program. So the program itself, how it's administered, how our grants are structured, and just sort of take a look at that a little more objectively and see if there's any ways in which we can sort of adjust the program to better meet the needs as identified in the plan. So in terms of the process we're going through at a very high level, these are sort of the steps along the way we're taking. And right now we are wrapping up the existing conditions phase. And we did this as a 2-pronged approach. So we did a statewide survey, which I'll talk a little bit more about later, as well as a statewide demographic analysis. We just this week presented that to our interagency advisory group, which we've brought together transit agencies, 5310 groups, and other state agencies that are related to provision of human services in general. And we're having them sort of weigh in on what they see as missing or any feedback they have on kind of the data we're collecting. So we're wrapping that up now. You can see at the bottom there some of our outreach approaches. So we did the survey. We're going to be, now that we have this baseline of information, conducting a gap analysis. So looking at the unmet needs and strategies to address those needs. As part of that, we'll be holding a virtual public meeting, as well as doing some more targeted outreach that's based at our grantee locations, so more on the ground outreach to gather feedback. And then as part of this plan, as I mentioned, we have some special priority areas. One of them is looking a little bit deeper into mobility management and how that can be better utilized in the state. So that's something that we can provide funding for and do provide funding for through 5310. But we really want to understand how we can perhaps encourage more mobility management strategies and provide more support for that. So as part of that effort, we're going to be conducting focus groups with mobility managers and case managers, so people working directly with clients who are seeking transportation and who are helping them identify the services in their area. And then finally, we will have our finished CHSM plan at the end of the day with all these elements combined. And so I did just sort of talk through most of what we've done, but this is just a little bit of a deeper look into where we're at and where we're going with our engagement strategies. So our goal is to engage riders, providers, program managers, peer agencies, and staff throughout the state to help produce this plan. So for the existing conditions, as I mentioned, we've done the survey. This was a statewide survey conducted primarily focused on providers and sort of digging into all the services they provide, how they provide them, but also to get a brief look at rider experience, knowing that in our gap analysis, we're going to be gathering more input on the ground from riders at the places they go to receive those rides from. And we'll also be holding a virtual public meeting to present some of those gaps and strategies and get feedback on those as well. And then, as I mentioned, going into mobility management, we're going to be holding some focus groups and some workshops to get a little more insight into how that's working through in the state currently and perhaps how it could work better. All right, so as I mentioned here, since we did just sort of finish up a lot of our survey collection and analysis, I just wanted to go over some of the general characteristics of who responded to our survey, as well as a snapshot of the findings from this survey that we thought might be of interest to this group in particular. And there'll, of course, be an opportunity for you all to provide feedback or comments on that as well. So to go into the survey a little bit, so we conducted an online survey of transportation providers in Virginia, as well as riders, about the services they offer and use. The survey was open for 5 weeks from April to May. For the providers specifically, there was close to 60 questions, and not all the questions applied to all respondents. The riders had a much smaller amount of questions to answer. And we had 577 total responses, 241 riders, and 332 providers. And so this survey was sent out through DRPT to all of our agencies. And through that, we asked them to also share it with their riders. So again, the rider number is a little small, but we're anticipating in this next phase that we'll be getting more targeted feedback from riders on the ground when we present our sort of gaps and strategies to them. And then the 332 providers, this was not just providers that were that are funded through DRPT. We also identified through our partnership with Virginia Navigator, we have a transportation directory with them of human service providers, which includes all different kinds of providers, both funded through us and not. So we had a good amount of respondents there to this survey. And you can just kind of see there the bar graph showing if it was a rider or provider completing it. To talk first a little bit, just briefly about the rider characteristics, approximately 49% of the survey respondents were age 65 or older, 50% were between the ages of 18 and 64, and less than 1% were under age of 18. And over 50% of the survey respondents reported that someone in their household has a disability that limits their mobility. So we get a pretty good response rate from the sort of eligible population that we're seeking to identify through this. Going over to the providers, just to kind of give you an idea of who was responding to the provider survey, 30% were area agencies on aging or community services boards. So that's, I would say, the majority of the grantees that we have through the 5310 program fall into those two categories. But 40% were other nonprofit organizations, which I would say is kind of the other majority or half of our grantees. 10% of the respondents were transit agencies, and 40% of the respondents are directly operated transportation or contracted transportation services. And some other respondents perform travel training and oversight or provide travel information referrals. So more of that kind of mobility management type of service. So going again, this is just a snapshot of survey results. There's about 60 questions, so I'm just presenting some information we got that I thought might be of interest. But going a little further into the providers, we asked the providers about, in general, the area they serve, and we asked them if residents in their area have the need to travel outside of their service area to access medical services. So of the 84 providers that respond to the question, 67% said yes, which is something we were somewhat expecting to hear, but wanted to look at that in terms of not just the services they offer, but their perception of services available in their entire service area. Again, looking at kind of the providers and their perception of their service area, when asked about the top 3 barriers or challenges to mobility in their entire service area, even outside of their own service that they provide, they most often selected lack of public transportation. So we know that there are many rural areas of the state that lack public transportation, so that came up to the top there. The next one that they identified, they perceived as the biggest challenge to mobility was the cost. So this included lack of funding, lack of affordable private sector transportation, and just the general cost of transportation services for their clients and the population. And then finally, they also identified hours and days of service that don't meet the needs or have an inconvenient or lengthy path of travel as a barrier. So again, not entirely surprising to us to see this, but good to have it sort of validated by the providers themselves when looking and thinking about who they're serving, but also what's available where they are. So for going more into mobility challenges and barriers, when they asked what are the top 3 biggest agency-focused challenges, so then looking out from their entire service area to just them as an agency, what are the biggest challenges they feel like they're facing? Funding, recruitment, and increased demand were selected as the biggest challenges. So when talking about funding challenges, we had responses about, there's some pull quotes here from the survey responses, that financial limitations are the primary barriers to expanding services. In terms of staffing shortages, that was another barrier frequently mentioned by respondents, and we know that's a national trend as well. And respondents reported that finding enough staff to run the service is a challenge. Both drivers and administration staff are mentioned as being in short supply, and many respondents mentioned a lack of specially trained personnel to help riders with specific medical needs. So looking for those folks who can help this population with their specific needs with mobility. And finally, in terms of the core mission, many respondents are unable to change and expand service because, again, among human service providers specifically, which were the majority of the respondents, transportation service are really tangential to their core mission of providing other wraparound services to their clients. So these organizations may be providing or arranging transportation services for their clients, but it's not their primary focus. And expanding any of those transportation services may come at the cost of their core mission. So it's sort of a balancing act for them to be able to provide transportation as well as all these other services. We then looked at planned service enhancements. So we asked, if, in identifying these challenges, we asked them within the next year or two if they had any planned service enhancements that they were thinking about. And in that, 36 of the responding providers said they are planning some sort of change or enhancement to their services. So we asked some open-ended questions about what they were interested in providing or looking into in terms of enhancing their service. And we identified 3 themes. So new service types, flexible funding options, and mobility management strategies. So under new service types, many commented on adding microtransit or increasing on-demand services as a way that they're kind of working to try and address some of these unmet needs. Providers also mentioned the modes like microtransit's flexibility and the ability to adapt services to their changing needs. And other respondents mentioned unique ideas such as delivery services to meet the needs of their community, while also using the existing transportation resources they have. So again, you can see some pull quotes there of what people were commenting on. Under flexible funding sources, many respondents mentioned relying on federal and state funding for their services, but that it was not enough to meet the unmet needs. So a great demand for services in their area. Some respondents reported looking into 5310 funding for the first time, while others described unique partnerships with other local organizations to fund their services. So they were commenting on how working with local organizations in need of transportation services can open the door to other funding streams that one of these human services providers may not have access to on their own. So looking at collaboration as a potential resource for additional funding, as well as expanding services or trying to meet the needs of the population. And finally, under mobility management strategies, many respondents noted increasing coordination with other human service providers in their community is how they plan to help meet the needs of their community with the resources they have available. So some respondents report already working with medical care providers, for example, or other agencies to coordinate trips and make their transportation services more efficient. And they want to often take this a little further, continue to look for opportunities where they can expand by partnering with other agencies and collaborating between them to kind of serve riders who are maybe accessing all these different services in their area. So finally, we asked both riders and providers to share their thoughts on what they perceived as the most needed enhancement for public transit and human service transportation. And from 240 responses, we identified 3 themes, which are somewhat broad themes, but give us some good insight into what they're thinking about as potential strategies that we can look deeper into in this plan. So the most needed enhancements they identified were service accessibility and expansion, service frequency and reliability, and affordability. So under accessibility and expansion, respondents, both riders and providers, repeatedly highlighted the importance of efforts to enhance service accessibility and expand service offerings. So there's a focus on increasing coverage through new or extended bus or train routes, particularly in rural and underserved areas, while also improving physical infrastructure and vehicles to meet ADA standards. Additionally, there was a push for reliable transportation options for recurring and specialized medical appointments, as well as support for volunteer driver programs and more flexible on-demand services for trained drivers. And one thing we heard from the IAG group, our advisory group yesterday, was considering things like dialysis appointments, these reoccurring trips and people who have specialized needs who really need trained drivers to help them with those services. Under service frequency and reliability, respondents emphasize providing more frequent and dependable transit options, including shorter wait times, consistent schedules, and improved on-time performance. They talked about increasing the number of drivers and enhancing their training, again, particularly with assisting passengers with special needs, along with a focus on customer service and strategies to elevate the overall rider experience. So you can see in that pull quote, I think from a rider, being on time, clean and safe vehicles with drivers who can meet their needs. Finally, under affordability, respondents focused on promoting affordability and fairness in their services by lowering fares, particularly for seniors, individuals with disabilities, and those with low income, and also by, through coordination among service providers and agencies to ensure equitable and efficient transportation access for everyone. So looking at how can they, look at affordability, both from the rider standpoint, but also from the provider standpoint, seeing where there's any opportunities to perhaps coordinate and reduce costs that way. So to just kind of reiterate the themes of the survey, again, I just provided a snapshot of some of the information, but overall in our survey, we found that there is a range of transportation services being provided across Virginia, and there are many for older adults and people with disabilities. However, the demand for transportation services is far beyond what's able to be provided currently. This is partially due to provider funding challenges for operations, drivers, keeping services consistent with their core mission. For riders, it's often due to cost of service, length of trips, and the days and hours of travel that they find a challenge. However, also throughout all of this in the survey, there's truly a shared appreciation and commitment to the services while recognizing these challenges. So the people who rely on these services truly do appreciate them and want to continue utilizing them while also recognizing that there are unmet needs. So I have a few more slides, but before I go on, I just wanted to give a break and see if anyone had any thoughts or comments that they wanted to share, questions before I go on.
Jess, there's none in the chat box, but I did have a question myself.
Sure.
I was kind of startled, the travel outside the area, I think on slide 17, the 67%.
Yeah.
How does that data compare to previous plans? Is that something that DRPT is kind of tracking, looking back at 2002 and previous ones and seeing? And I only ask that question because of the news articles, it seems like the last several years about kind of rural hospitals closing, rural healthcare kind of getting smaller.
Yeah.
It seems like tracking those trends and putting them in a perspective of knowing what future plans may say and what the future demands may be for traveling outside areas as healthcare becomes more challenging in more rural areas.
Yeah, I would say, Danny, that's a great feedback for this plan and something I would definitely like to incorporate and look at further. I think I don't know if in the past, just off the top of my head, if we've asked that specific question, but I think from, previous plans and survey responses that we've gotten, I think we could probably extrapolate some of that information. But I agree. I think that's an important one to keep in mind going forward from this plan and continue to look at. So thank you.
You're welcome. Yeah, just like having a little mini chapter of future trends to look forward to and
yeah.
I think would be helpful for providers also kind of getting an idea of where the industry is going or what their communities may be directing to keep in mind for future services.
Great. Thank you.
Any other questions for Jess? None in the chat box or Q&A.
Okay. I'll go ahead and move along then. And Danny, your question is somewhat prescient because I'm going to talk to you a little bit about, again, something we thought this group might find interesting. So we found as we were starting this plan that there's actually a simultaneous study happening that's being conducted through the Governor's Joint Commission on Healthcare. So the Joint Commission, in case you're not familiar with it, which I wasn't, is comprised of 18 legislative members, members from the Senate, as well as the House of Delegates. And basically every year, this commission, again, focuses on healthcare in the state, but in December of this past year, they voted to include a study of transportation barriers to healthcare services. And they're looking specifically at rural areas. So this study is being conducted at basically the exact same time as the CHSM plan. And their study includes a lot of the same elements as the CHSM plan. So describing the barriers to transportation, specifically to healthcare, which ours is not specific to healthcare, but of course includes it. Identifying and evaluating existing interventions and programs that address the transportation barriers, and then identifying strategies that we could implement to address them as well. So the goal and ultimate conclusion of the JCHC study is to recommend policy options through which the state may reduce these barriers to healthcare. So we are working very closely with the policy program manager who is working on this study, and we're sharing information to ensure that between the CHSM plan and this transportation study that we aren't, doing anything that doesn't align or we're not finding any mismatched data or anything like that. So I just wanted to bring this to y'all's awareness because this study, I believe, will be presented to the Joint Commission in October, which is a little before when our plan will be released. But we're playing a big role, I would say, in helping to identify those strategies and seeing, they're asking, what are the prioritized we're seeing coming out of this plan as well. So again, this is kind of an exciting opportunity to, obviously it's a little funny when you have two very closely related plans going out at the same time, but we're excited to be able to work with them to maybe see some of these priority areas go up in front of this commission. So I want to make you all aware of that going on. And finally, I'm going to close out here in a moment, but also, again, as part of this planning process, we're kind of in the midst of it. And as part of it, we're asking for participation from everyone in this call and everyone we can find. So if you're a transit agency and you didn't take our earlier statewide survey in the spring, or you're not sure if you did, and you're willing to talk to me and our consultant team about the supportive transportation services you offer, please feel free to reach out to me. There will be other opportunities for you to participate as well, but we'd be happy to have a short chat or email about your services because we really are trying to incorporate all the information we can into this study. Also, if any of you are attending the CTAV Expo and Conference, we will be presenting more information about the CHSM plan and findings on August 19th, so the first day of CTAV at 8:45 a.m. So if you're an early riser, please feel free to join us there. And finally, we have a link, and we'll send the slides out afterwards. But we have a dedicated page on our website where we'll be kind of posting more opportunities. So if you want to save that, you're also, I think, most of you are probably on our email list. But again, if you're not, feel free to reach out to me and we can get you added to that to make sure you get notified about anything coming up. So with that, I'm going to close out and just see if anyone else has any more questions. Those are our emails, also the email of our project manager from WSP, who's our lead consultant. So any of us are happy to engage with you and answer questions now or in the future. So
Excellent.
with that, if there's any questions or anything, Danny, I can't see, but let me know.
Yeah, no questions. And thank you again, Jess, and please share any opportunities to comment or to get involved, and we'll put those in our weekly newsletters and make sure to get that out to our list. I'm sure there's a lot of overlap, but there may be opportunities. And I see Jessica Kelly has raised her hand. I don't know that we have the ability to allow folks to talk, but if you want to put your question, Jessica, in the chat box, I can ask it. There it is. Oh, it was an accident. She raised her hand on accident.
No worries.
All good. It's Friday. It's like 100 degrees out this week. And it's holiday time almost, or vacation time. But thank you again, Jess and Evan, for presenting today. We greatly appreciate it. And please keep everybody out and have an enjoyable Friday, and keep aware of the plan. And we'll help provide more information as it comes out on the CHSM. And please look out for CTAB as well. That's a great conference every year. So thank you all, and have a great Friday. Thank you.
Thank you all.